hidradenitis suppurativa, also known as HS, is a chronic inflammatory condition. Typically, patients will develop these recurrent, painful, inflamed lesions, often in the underarms, the inguinal region, and the anogenital region. And HS is characterized clinically by Hurley stages. So these describe the level of severity and scarring associated with the disease. And this ranges from Hurley stage 1, which is more mild disease, all the way to Hurley stage 3, which is more severe disease with significant scarring. There are many medications that are used to treat HS, but overall the response can be variable. Some medications that we typically use include topical and oral antibiotics, hormonal medications like spironolactone, as well as biologic medications. Additionally, we can use procedural interventions for hidradenitis, including intralesional Kenalog injections, as well as procedures like de-roofing or local excisions. And so in addition to just affecting the skin, HS has also been linked to many other conditions and can significantly affect patients' quality of life. Conditions like depression, substance use, chronic pain have been linked closely to HS. Additionally, given the sensitive nature of the disease in terms of the locations that it affects, it can also affect interpersonal relationships. Yeah, that's a great question. So it can present as early as adolescence, but there's also later presentations in patients in their 60s or 70s. The majority of patients develop HS between the ages of, I would say, 13 to mid-20s. Yeah, so we do have strong evidence that HS affects Black and biracial individuals more than other races. There was one study that looked at HS prevalence in the United States, and authors found a higher prevalence in HS in Black and biracial individuals, with a prevalence of HS among Black individuals of a threefold higher and biracial individuals twofold higher, respectively, than that among white patients. And these same findings have been seen in children with an overall prevalence rate of about 28 per 100,000 overall, but a higher rate of 79 per 100,000 in Black children. Unfortunately, we don't know why this is. The pathogenesis of HS is incompletely understood, but it is very relevant clinically. Because in addition to just the higher prevalence in minority patients, we also know that outcomes are worse for our minority patients. Some studies have shown that both Black and Hispanic individuals experience more severe HS. Studies have also shown that there's a longer delay in diagnosis in Black patients with HS compared to white patients. We also know that patients who present at later stages often have more severe disease, which can be more refractory to treatment. So early diagnosis and treatment is really essential. So clinical trial participation is an area where disparities continue to exist in HS. And while this is relevant across many disease states in dermatology, it's particularly important in HS given the higher prevalence of HS in patients of color. One review specifically of HS clinical trials reported underrepresentation of Black, Hispanic or Latino, and American Indian or Alaska Native patients. And they constituted only 13.7%, 7.2%, and 1.3% of the trial population, respectively. When we're considering the reason why, the answer is likely multifactorial. So it may include strict inclusion criteria, which could limit participation, for example, of patients with comorbidities. We also have to consider our recruitment efforts for minority patients in clinical trials. Maybe we're not capturing a diverse population. And then finally, we also should consider differences in patient interest. The distrust of the medical system is another factor which can lead minority patients to forego clinical trial participation. And this is something we really need to address on a national level. So there are many. I would say continuing to seek out ways to increase clinical trial participation is imperative. We need to do that in order to determine whether medications will work for all of our HS patients and not just a small group. Additionally, an increased focus on research funding is really important for HS. We need to seek out alternative treatment options because this disease is very variable in terms of patient response to medication. Much of my own time as a physician is spent navigating the complex insurance system in an effort to help obtain medication coverage for my patients. This is a significant barrier to achieving disease control. So ultimately, better insurance coverage and patient support for these necessary medications will also help reduce disparities. I'd like to close by just mentioning that though HS is a dermatologic condition, it affects much more than just the skin, and it should really be considered as a life-altering illness. We need to continue to advocate for research in this condition in order to help improve patients' quality of life.